Thanks very much for staying with us. Time now for Eye on Africa with me, Georgia Calvin-Smith. Tonight, the World Health Organization calls for a coordinated international response to the spread of Mpox to a total of 13 countries on the continent since the first cases of the most recent outbreak were registered in DR Congo in September. Also, a glittering launch. Ghana opens its first commercial gold refinery, hoping to earn more from the precious metal that's been mined there for centuries. But some warn that the partnership may not have Accra's interest at heart. And Senegal cracks down on tax evaders and ramps up taxes. But the move meant to generate income for social reforms, putting pressure on key sectors. But first, a day after the Africa CDC's declaration of the continent's most recent Mpox outbreak, and the World Health Organization has now determined the crisis to be a global public health emergency. The WHO has called for an international push to respond to the surge in cases since the first infections were detected in DR Congo last September, before spreading to other countries, including Burundi, Kenya, Rwanda and Uganda. More than 17,000 cases and 517 deaths have been recorded on the continent this year. The current strain is more virulent than the one that caused the 2022 10-month global Mpox outbreak. Africa has a tougher time responding because of a scarcity of vaccines. And until that gap is filled, which may take months, health NGOs have been emphasizing the importance of sanitation basics in the pushback against the spread of the virus. With me now for more on this is Irene Owusu-Poku from WaterAid. She joins me from Accra, Ghana's capital. Irene, thanks so much for making the time to speak to me. Now, first of all, what do you and your colleagues wish people better understood about the role that something as simple as clean water can play in an emergency response to the spread of infections like Mpox?
Hello, thank you very much, Georgia, and greetings to your viewers and listeners all over the world. So Mpox, first identified in 1958, is caused by monkeypox virus. The warning is that without clean water and good hygiene, it's actually impossible to contain the spread of the virus, which can spread across borders and claiming more lives. And with reports actually saying that inadequate vaccination provision is likely to be months away, and WaterAid warns that now is the time for us to emphasize that communities need access to water, sanitation, and hygiene to actually minimize the spread of the infection, claiming more lives. And also, water is actually very essential. And I would want to say that I'll look at it from the prevention and then the treatment or management side. Water is needed in prevention of this Mpox virus, and within the prevention mode, healthcare facilities need adequate water for regular hand washing. Also, individuals, the population need regular supply of water for hand washing. Very key for everyone. And then wash actually is important. Water, hygiene, sanitation is even important for the treatment and management of cases. For example, using high salinity water for bathing and even in sitting baths for body sores. These are very important. And we think that it's important to emphasize that water, adequate water for that matter, is essential in this menace.
So as recently as 2022, we saw a global Mpox outbreak, but that was rolled back. Besides the lack of vaccines, is there anything unique to the African context that you think makes it harder to bring down transmission numbers?
Well, this is actually a multifaceted problem. Within Africa, we have fragile healthcare system. Over the period, leadership of African continent have done their best to strengthen healthcare system. The issues are compounded by many factors, including limited wash infrastructure, even in our healthcare facilities and communities. The emphasis also is that water is key, is basic, and we need to ensure that our communities and healthcare facilities are provided with such commodity.
And are you concerned about any particular demographics that you think are at particularly high risk for infection, or even just the fallout from the effects of trying to push back against the outbreak?
Sure, the defects actually can affect anybody. The disease can affect anyone, and reports indicate that people who are identified as gays, bisexual, are very seen to be infected. But in current spread, Africa CDC has actually mentioned that 70% of the cases in Congo are in children and younger people less than 15 years, who actually account for over 85% of death. And we think that women and children are most vulnerable because they are actually close to each other, and also within overcrowded areas, especially within certain areas where infections are high in Africa.
Irene Owasupoku, thank you so much for giving us some of the insight there from WaterAid on how really basic things like access to clean water and hygiene are essential to push back against viral outbreaks. Look at some other news. Demonstrators calling for peace in Sudan gathered in Geneva on Wednesday as US mediators tried to launch a new bid to broker peace between the warring sides behind 16 months of war in the country. A delegation of the RSF paramilitary, which is on one side of the fighting in Sudan, did attend the talks in Switzerland, even though the army, which is on the other side of the conflict, has chosen to stay away. Now, the US has urged the Sudanese government, which is closely affiliated with the army, to take part, saying that they have a responsibility to try and thrash out a negotiated solution to fighting, which has cost tens of thousands of lives and triggered the world's largest displacement crisis.
I expect the warring parties to cease fire now, give access to humanitarian aid, and negotiate peace. We are not naive, but this is critical now, and they have to sit down and negotiate peace.
The military, every time, this is a last chance. We want them to come to negotiation. We want peace. We want justice for Sudanese.
Well, Tanzania's main opposition party says that several of its top leaders have been beaten during arrests at a banned rally. Chadema chairman Freeman Mbowe and his deputy Tundu Lissu, both former presidential candidates, and other senior officials were freed on bail on Tuesday after having been arrested ahead of Monday's planned youth event in the southwestern city of Mbeya. Now, police say that 520 people were arrested across the country ahead of the gathering.
Our party has never been a terrorist party. We've said from the beginning the accusations of political authorities are baseless. Baseless. The actions of the police towards us are equally baseless.
Now, Ghana's opened its first commercial gold refinery. The country's the continent's top gold producer, and the government has a 20% stake in the project in Accra. But whilst the country is hoping to earn more from the precious metal, some observers aren't so sure that the setup of this project is the best way to go about this. Justice Baidu talks us through.
Refinery was greeted by huge local and international press, heralding what the government say could reduce the amount of raw gold that Ghana currently exports.
Initially, it is expected to create 80 to 120 direct jobs and another 500 indirect jobs, boosting domestic tax revenue in the form of corporate taxes and enabling us to refine to 24 carats.
The Royal Ghana Gold Refinery has a capacity to process 400 kilograms worth of gold per day, sourcing mainly from artisanal gold miners in the country. The country's central bank says this would also boost a gold buying scheme that it has introduced to help protect the value of the local currency, the cedi.
This follows a pattern, or is consistent with a pattern of government projects that are announced as if they are large-scale national transformation projects. But in actual fact, when you look closely, they tend to be driven by commercial interest of close associates of politicians. We call this state enchantment. Number two, the impression has been created that Ghana never had refineries, and all of a sudden, through this project, we have a refinery. So this is a game changer for the gold industry in Ghana, and that's not true. Ghana has almost 12 refineries. And in fact, this is not even the biggest refinery.
Ghana produced over 3 million ounces of gold in 2023 alone.
Well, Senegalese President Bassirou Diomaye Faye has introduced sweeping tax reforms since taking office earlier this year in the hopes of boosting state revenue and financing social programs. Many sectors, including big tech and the media, are facing higher taxes, whilst various loopholes are being closed with a zero-tolerance approach to tax dodging. But there have been some unintended consequences. Our team reports.
Crowds of young Premier Bet employees have gathered outside of the company's Dakar headquarters to pick up their letters of dismissal. Bosses here say the business is having troubles with the taxman. More than 900 people have been fired.
They explained to us that they have a problem with the tax authorities. That is what the director told us. We're not okay with this. We are the ones who work on the ground and know that the company has made profit.
Premier Bet's director was arrested earlier this month for fraud. With a clampdown on tax dodgers and new higher rates of tax for certain industries, the Senegalese government drew in record revenues in the first semester of 2024. But this analyst says the government is taking a risk.
It's a double-edged sword. It will allow the government to mobilise funds, finance the budget and have more resources. But it could be counterproductive. If you put too much pressure, the economic science and the Laffer curve shows that tax rates which are too high actually reduce tax overall. If the tax is too high, people might not pay any tax at all. I think we need to find a balance.
Tax authorities have put up posters across Dakar reminding people that paying taxes is a crucial civic duty. Senegal hopes to draw record revenue this year as the IMF has projected GDP growth of 7.1%.
Well, that's it for Eye on Africa. Thanks for joining us, though. Do so again. Till then, take care.